And closing us out this morning and for the course will be Dr. Kristin Vickers. She is a professor of psychology who works in primary care and integrated behavioral health. And she's going to be giving us some tips on motivational interviewing and ways that we can help our patients achieve their goals. And I think what you'll find as you listen to her is not only will we be able to do that, but we ourselves will be a little less frustrated and a little more fulfilled as we're going about it. So Kristin, welcome.
Motivational interviewing, the name isn't a very good name because it's not an interview. You know, when you think about an interview, you think about maybe a script or an interview guide. An expert is asking questions and someone else is responding. So motivational interviewing is more of a conversation. And I'll be walking through some very specific strategies that may help you, especially when patients are ambivalent about change. Let me ask you something. How many of you flossed every day you've been in Hawaii on this trip? Hi. Okay. How many of you did not? Honest. Okay. Now for those people, I'm in that group too. Do you have floss? Say yes loud if it's true. Could you teach my 7-year-old how to use it? Have you ever been told to have this, maybe by a dental professional? Do you believe it's healthy? Keep saying yes if it's true. Okay, do you have the motor abilities to do it? Are you financially able to make it happen, right? You got it all. Okay, now here's the really telling question. How many of you have more than one container? Okay, right? And how many of you will have an uptick in your flossing the week of going to the dentist, right? Okay, so now think about how, for those of you who are non-adherent, I use flossing as an example because we don't have a lot of shame and guilt and difficulty discussing this in a group setting. Think of more complex behaviors where we're really ashamed, we're stuck. Our patients and perhaps ourselves, we know what to do, we're not doing it. And so if you think about, if I flipped this talk and just said, you know what, we got to get you all flossing, I'm going to show some bloody gums, I'm going to do a demonstration, think about what would happen to your relationship with me. You're going to be frustrated, you're going to be sneaking out. Even if the topic resonates with you, the fact is I hijack the conversation and I tell you what you need to know.